everybody says, that's Brad. Good morning. It's Wednesday, April 1st, 2020. I'm Marilyn Smith, Communications Officer for the City of Albany, here today with the people who lead Albany's first responders, Police Chief Marcia Harnden and Fire Chief Shane Wooton. The chiefs had planned to chat with you in person, but the abrupt change in all our lives caused by the novel coronavirus COVID-19 brings us online instead. From the appropriate social distance, Chief Harnden and Chief Wooton will talk about Governor Brown's executive order, how our police, fire, and ambulance crews are working to keep you and each other safe and healthy, and how you can help them and your neighbors through this emergency. If you have questions for the chiefs or for other city staff, please contact us through Facebook or email through the city's website, where you can find up-to-date local, state, and national information about the virus. Chief Harnden.
Good morning, everybody. Welcome to April. March was an interesting month for us here in the city, and I'm happy to report that our workforce is doing well. They're healthy. You noticed some changes that we made and how we interact with folks. We closed a lot of our public access points, but it doesn't mean we're not out patrolling the streets. We're actually quite active. Our staffing is good, so we're able to respond to any emergency on the law enforcement side.
Okay. How are you focusing patrols?
We're focusing on the hot spots right now, which that has changed a little bit with the social distancing issues, and we're focusing on hot spots. We're tracking daily as to where the activities occurring in the city. We are responding to a couple of complaints in regards to the governor's stay-at-home order. We approach that from an education standpoint first, giving warnings, and enforcement is the last resort for us, but it must be taken very seriously. You're either part of the problem or you're part of the solution, and we want everybody to be part of the solution.
What is the most important thing that people need to know about Albany Police right now, about your operations?
We're fully staffed. We've had to make some changes in our public interactions. Again, our lobby is closed, and that's for the health of our staff. We can't have people call in sick. We have to have police officers, dispatchers, and other staff working. So we have had to close a little bit of our public access. People are used to having that one-on-one contact with police. They can still have that, so we're taking a lot of reports by phone, or we'll let limited people into the building, things like that. But if there's a major incident that occurs in the city, and we did recently have one, we can fully respond to it.
Can you talk about the new service that you're providing with prescription delivery?
Correct. We took an example from our neighboring police agencies in ways to help the community that are most vulnerable, that may not feel safe going into a pharmacy or anything like that. So if they prepay for a prescription that is very important for their own health, but they don't feel comfortable in getting it, they can call us, call our non-emergency number, and we can set up an arrival, pickup, and delivery to their home.
Thank you. Have you been receiving reports about online or telephone scams related to the virus?
Daily. I think it's important that if you are looking for testing, go through your recognized health providers, your hospitals and your primary care providers. Chief Wooton talk a little bit about that if you do need testing. There's people talk about the scams for the federal assistance that's coming out. We're right in the middle of tax season as well. Those scams are out there. The important message is to never click on anything that you're not sure of or don't recognize. Nobody will ever ask for your information, your credit card information, your date of birth, your social security number. Don't fall for that. It's very important. So there are people that are taking advantage of the situation and preying on people's fear.
Is it true that we've suspended the speed limit in Albany?
Some people might think so because the streets are wide open, but no, we've made a number of traffic stops. You still can receive a ticket. The last thing we want to do is tie up our people with collisions and things like that, so we need to be mindful of all the traffic laws, particularly if you see a wide open road and traffic volumes have dropped, but we will enforce the law.
Okay. Chief Wooton.
Yes.
Talk to us about emergency medical response.
Sure. Well, first off, let me just say my name's Shane Wooton. I'm the Fire Chief of Albany Fire Department. And I wanted to start just by thanking the City of Albany, the community of Albany or surrounding areas, and our community leaders for their continued support as we navigate these uncharted waters. I'd also, if I could, before I answer your question, is just to let you know that the fire department's heart goes out to all those who have been affected by COVID-19, whether that be through a sick loved one or a lost job or a shuttered business. Our heart does go out to all of you. So anyway, thank you for indulging me. Your question again, please?
Wanted to know how you are dealing with emergency medical responses. It's different from a typical ambulance run.
So before COVID-19, we would respond on an emergency just dressed like I am. We would have gloves on and we would engage with our patients and our customers in just really kind of a normal social manner. But since COVID-19, we've had to really step up the amount of protective equipment that we wear. And actually brought a couple examples of what you likely will see if one of our people come to your house. First off, what you'll see is that our people will be wearing goggles. As most all of you know by now, that COVID-19 is spread through droplets. So we really, our providers need to protect their membranes to avoid contracting the disease. So they'll wear goggles to protect their eyes. They'll also be wearing some variation of a mask, again, to protect the spread of the disease. And even in some cases, you'll see that our people will have a full, they'll maybe have a gown on, or they'll have a full PPE ensemble where they're pretty much covered from head to toe to protect themselves. It has nothing to do with us thinking that you potentially have COVID-19, but it's more just that we are protecting our emergency responders, that they don't contract COVID-19, because our firefighters live together and live in a fire station for 24 hours at a time. So it's, if one person, one firefighter contracts COVID-19, it's highly likely then he or she would take that back to the station and potentially spread that disease to others. And then of course, we don't want them taking that COVID-19 home to their family. And lastly, to close out answering this question, why they're wearing all this gear is also to protect you. We visit and treat a lot of our most vulnerable people in the City of Albany who could become very, very ill from COVID-19. So we want to make sure that we're not transmitting or carrying the disease from one location to the next.
We have heard a lot of news nationally about shortages of protective equipment. Do we have enough for our first responders?
We have received a number of donations, and I want to thank the public for that. We've not only corporate donations, but public donations. That does help us. Right now we're doing okay, and so we make sure that our emergency operations center and the fire department knows what stocks we have, and we can share with others as well. But we very much appreciate the effort that the public has had to step up and give us hand sanitizer, gloves, masks, and so on and so forth. And to jump on to something that Chief Wooton said too, you may see police officers act a little bit differently. You may see them wearing a mask, gloves, and some eye protection as well. We go to a lot of the same calls together. So we may ask people to step out of their houses to talk to us. So we're in an open air space where we can have some more distance. You're going to get asked questions by dispatchers before we come to your house. We may treat people a little bit differently as we arrest them. It would take us longer. We have to decontaminate a car every time we transport somebody. So we've had to make some changes as well. And so you'll see the police officers as well as firefighters wearing more protective equipment.
You mentioned dispatchers. When should you call 911?
So when you should call 911, first off, if you start to develop symptoms that you think you may or may not have COVID-19, but you're not feeling well, the first thing I'd encourage you to do is to try to isolate yourself in your home. And then your family members should, using a household cleaner that kills the coronavirus, should go around and clean up behind you. And then at that point, if your symptoms start to progress, your first step before you call 911 should be to contact your primary care physician. He or she can help you navigate what the best step is forward, whether that be that you need a COVID-19 test, or if you just need to really quarantine yourself for 14 days. They're going to be able to guide you through that decision-making process. But then if the disease progresses, and this is not only true for COVID-19, this is true for any sort of medical emergency. If you start developing chest pain, shortness of breath to the point where your lips are starting to turn blue or your hands are turning blue, maybe you can't talk in a complete sentence, those would be times when you would want to call 911.
Okay. What should you do when you first have symptoms or think you have symptoms?
So, like I mentioned, the best thing you could do is what Governor Brown talks about is, stay home, save lives. So if you start to develop symptoms, isolate yourself in your home. And not only are you doing what's best for your own health, you're also protecting those people around you in the greater community. And like I said, have household cleaners around where you're able to go and to wipe down the door handles, or your family are able to go wipe down the door handles that you were using or items that you touched. But really, what we just, as a fire department and police department, what we're asking you is to stay home, save lives. We really can't say that enough to all of you.
This is really stressful for everyone, for the public, for coworkers, for you personally. How are you handling this in your own personal lives?
In my personal lives, it's caused us to have a lot of conversations about, what is our plan if one of us becomes ill? What bedroom in the house are we going to say is the room that we're going to quarantine in? And we've just started to have our own family discussions that, quite honestly, 4 months ago, I would have never expected us to even be talking about this type of thing. And here we are. I'd say the other thing personally it's taught my family, our family, is that, the importance of being prepared and having food available and apparently having toilet paper available. That it's just, it's more important probably than we realized.
Chief?
Trying to keep some levity about it, a sense of humor. We, as many people, enjoy the humor that comes out of our social media and the police department. That's a lot of our own way of bringing a little bit of humor into a very serious and scary situation with a good message there. So internally, we're doing the same thing. There's no shortage of giggling and laughing and just having a good time connecting with our own folks from a safe distance. But also, me personally, I'm trying to stay as active as I can. Our typical things, I'm a lifelong soccer player. We can't do team sports right now. Anything to stay healthy, get outside. I see a number of people in Albany walking their dogs. Just be outside, get fresh air. The other thing too is limit your exposure to social media and to the news. Right now, it's all everybody's talking about, and I don't think it's in anybody's best interest. Find something that you really enjoy and connect with that, and I do that as well. So I'm trying to avoid how much I'm reading and consuming because we have to deal with it at work, so just get away from it. Go for a long drive and explore the area, something like that, something healthy to engage in.
Chief, that's great advice. A good laugh is healthy.
Yes, absolutely.
And there are professional sources for people to tap into.
Yes, in fact, I had a discussion with our representative from King County, or Lynn County Mental Health. Sorry, it's my old days coming out. And they are still there for people in Lynn County. They have to change their practices, but they are still available. Please reach out to a safe source to have discussion if feelings are getting the best of you and you feel a bit overwhelmed. Try to get some perspective on it. We were warned that this was coming into the state. We saw what was occurring in the state to the north of us. Some good protections were put in place, so people should feel good about that we were able to get ahead of it a little bit.
You know, another thing we haven't mentioned that people can do is also dial 211, that if they have questions and they're not sure where to go to get an answer, that could be a good starting place for them.
That's right. And I'd like to take advantage of that opening to remind people that our website has an enormous amount of information about coronavirus from state, local, and federal sources in English and in Spanish. It's right, there's a link right on our homepage. Click on it and you'll find it. It also includes a link to albanyrecovers.org, which is a site to connect donations and volunteers to people who need those donations and need some help. So those sources are available. Anything else that you would like to say in closing today?
I would like to add, as a resident of Albany, do our best to support our local businesses. This has had a huge, devastating impact on some of our small businesses. We're doing our best to encourage that our folks take care of these. If businesses need assistance, need us to watch out for their businesses, we'll do that. Just send us an email saying what services they're looking for. But again, let's support our local businesses. This is really tough on them.
I couldn't agree anymore. You know, I've lived in Albany now for a little over 25 years, and Albany's gone through its ups and downs over that time, but one thing has been consistent, that as a community that we pull together and we look out for each other, and I have no reason to think that the same thing isn't going to happen now as we navigate COVID-19. You know, you'll see firefighters were posting on social media that, you know, where maybe they used to cook meals inside the station, that, you know, some of them now are visiting some of our local eateries that have takeout options. And, you know, I know my family is doing that, and I encourage if other families have the means and the ability that they're able to do the same. So, you know, we're able to help those people that need our help right now.
Thank you. I wanted to remind the people who are watching that this broadcast will be posted on our coronaviruses page, on YouTube and Facebook pages for Albany Fire, Police, Parks and Recreation, and Library, and the main city government page. Stay home and stay safe, and thanks for watching.